Good morning, Supervisors. Zeb Feldman with CEMA OE3. CEMA proudly serves our county, and to close our contract, we ask for one thing: longevity pay. Behind me, members will explain how we pay for it, why it serves your employees and residents. I have a different point to make. Our county is a great ship. Your specialized crew is CEMA. A mass of icebergs hurtle towards our ship. Wildfires, floods, pandemics, and $20 million strikes. CEMA is your proud professional partner, keeping the ship running efficiently with no overtime. This special relationship demands special acknowledgement. When an iceberg hits our ship, others look to jump. CEMA always grabs a bucket. We're now asking you to grab a bucket for us. Authorize a longevity step now. We have stood with the county. Now's your chance to stand with CEMA. Thank you for your kind attention.
Good morning, Board. This is Adam Cole with CEMA OE3. I'm here with good news. CEMA negotiations are close. In fact, CEMA's last proposal to the county actually saves you money over the next 3 years from what's already currently on offer. Our proposal stretches some of those dollars to add a longevity step that kicks in 3 years down the line to retain our highly skilled and experienced members. I have more good news. Enough money is already budgeted to pay for the longevity step. As this board well knows, CEMA has 675 current vacancies in our positions, and most of those, maybe half, are likely about to be deleted. And those duties, we know, are going to be absorbed by the folks you see in maroon behind you. Every costing we've seen of our contract thus far assumes from the county that in years 1, 2, and 3 of our contract, CEMA is still going to have those vacancies. However, we know that most are about to be deleted. That money will immediately go to fill the budget hole. However, there's an additional savings beyond that.
Good morning, Board. I'm Neil Zash, the District 90 District Representative for the Operating Engineers Local 3. OE3 is the largest construction local in the county, and CEMA is our public employee branch affiliate. These are our union brothers and sisters out here in support. As professionals in our trade, we understand the value of our experienced operators. They are knowledgeable and skilled, and they ensure safety on the job sites. They also are responsible for training the new employees and ensuring they comply with the rules and regulations. It is essential to prioritize your experienced staff. Other professional unions in Santa Clara County have already implemented longevity pay. We request your support in treating our CEMA brothers and sisters fairly. We urge you to extend the same longevity pay benefits to them that other professionals receive. Thank you.
Good morning. I'm Andi Van Wagner, RN CEMA member, representing Primary Care Services as Service Line Director. I'm incredibly proud to be here today as part of the HHS leadership team and to highlight the remarkable dedication of our CEMA leaders, especially in times of crisis. Consistently, CEMA leaders provide and safeguard county public healthcare services. As an example, the recent nurses' strike showcased their outstanding dedication or commitment to safe, quality, and uninterrupted care. We work long hours extending over the Easter weekend through the Cesar Chavez holiday. We didn't do this because we were told by our bosses, but we did it because your CEMA hospital leaders refuse to let our services fail in any way. As a nurse director, I understand that building a strong leadership is extremely difficult. Fortunately,
good morning, Board of Supervisors. I'm Flores, PM3 at Valley Health Plan. As a senior manager in the county, I'm proud to say that I have amazing CEMA staff who work for and alongside me. One of my direct reports just recently helped us navigate to score 100% on our health equity accreditation. Unfortunately for my staff, I'm not retiring anytime soon, which means they'll have nowhere to promote within their department and chain of command. As within many CEMA managers with niche expertise, we're actively recruited by our competitors, including Kaiser, Santa Clara Family Health Plan, UCSF, and others. This is a common predicament with CEMA managers who hit that top step in just a few years. We work for the county because we care deeply about the public mission, but we feel the pressure to be financially responsible to our families in a high cost living area and seek promotion where available. Our CEMA managers are those who prioritize the county's mission. Please prioritize the staff who make the county's mission their priority.
Good morning, Board. I'm Martin Olson, Senior Equal Opportunity Officer with the county. I was born and raised in Santa Clara County. Unfortunately, I found myself out of work due to a back disability and back surgeries. I was out of work for 13 years. I went back to college, received my master's degree, and I give back to my county. My partner and myself adopted a son out of the Santa Clara County Foster Adoption Association. We have served as a foster home for several years, and I have served on the AIDS Planning Council as a county commissioner. So I support my adult son now, who has disabilities related to his in utero substance exposure and alcohol exposure. As I plan my retirement, I consider transitioning to a lower cost of living area because it's too expensive to live here. Equal opportunity is a niche skill set that's highly recruited, and I would love to finish my career in the county that I've supported and the county that supported me, and the longevity pay will make that difference. Please support CEMA's longevity step increase.
Good morning, Board. My name is Marco Aosta Mesa, and I am a CEMA nurse. I'm here to ask for your support in the longevity step that CEMA is asking for in our negotiations with the county. CEMA nurses would like to ask for parity with other nurses in the county in terms of steps. More importantly, however, I think that this benefits the county because you get to keep your most experienced and skilled workers within the county, rather than losing them to the private sector. I personally have seen many previous colleagues leave the county due to a lack of financial incentive to look forward to. During the recent strike, CEMA nurses dedicated their time to train travel nurses and help keep our patients safe. We look forward to your support in this matter. Thank you.
Good morning, board members. My name is Melissa Abadaka, and I am a program manager and CEMA member in the Public Health Department. During the pandemic, I coordinated vaccination clinics for some of our most vulnerable populations and served as one of the operations chiefs responsible for our mobile vaccination program. Working on the front lines during the COVID-19 pandemic is one of the most significant chapters of my life and career. Together, we administered over 150,000 vaccines. From the onset of the pandemic, I witnessed the unwavering dedication of our managers throughout the county who worked tirelessly on evenings and weekends for months and years, all with the sole aim to safeguard our community's health and well-being. Our collective effort and commitment to public health earned us national recognition, a testament to our incredible store of expertise and knowledge that wasn't gained in a week or even a year. Not surprisingly, our managers regularly are heavily recruited by some of our competitor employees. Longevity pay and another step to incentivize long-term dedication to the county will be a significant factor. Thank you.
Good morning, Board of Supervisors. My name is Frank Wildland. I'm the acting Chief Park Ranger with the County Parks, and I'm a CEMA safety member. With over 25 years serving Santa Clara County, I set my career goals and navigated through the steps, growing with the Parks Department and gaining leadership skills. I've been especially delighted to help manage and guide the Park Ranger program that's maintained safe parks and access and positive experiences for our community. At this point, I represent a reducing group of CEMA members who still possesses the historic and institutional knowledge of my department. My peers from outside agencies have considerable higher wages and salaries. We've lost long-term safety members who might have stayed extra years given the county had supplemental longevity. A longevity step can benefit my partners at work and my CEMA partners to supplement retirement and other needs to maintain competitive employment. Thank you.
Good morning, Board. My name is Phoebe Lee. I'm one of the Assistant Director of Pharmacy. We have a group of highly knowledgeable and talented pharmacy leaders who know how to run a safe and efficient pharmacy. This group of leaders is responsible for transforming our service line into a revenue generator for the county and helping to execute one of the largest public health initiatives today with the Levi's mass vaccination. Unfortunately, with 4 assistant directors and 18 pharmacy supervisors, there isn't enough room to promote from within. Any one of our pharmacy supervisors qualified to lead a pharmacy department and another health system. And as a matter of fact, we recently lost a highly experienced pharmacy supervisor to Stanford, and it's a huge void we're struggling to fill. Our pharmacy leaders work here because they care about our mission, and implementing the longevity pay will provide incentives to stay. It also shows that the county recognizes and prioritizes those who dedicate themselves to serving our community. Thank you for your support.
Good morning. Dolores Morales, President, proudly serving CEMA members.
I stand before you today grateful for the collaborative spirit that binds us. Our journey has been marked by partnerships, creative solutions, an unwavering commitment to our community. I'm proud that our members, once visible, now stand boldly, fighting for their experience and expertise gained through the years of service. In times of difficulty, skilled managers play a crucial role in navigating challenges and are the backbone of operations. Their dedication to our staff and community is unwavering. We need to finalize our contract with the last piece of the puzzle. We have several challenging years ahead of us. Let's get through them together. I want to thank administration. Your creative solutions have been a beacon during turbulent times. Thank you for treating CEMA with dignity and respect. Authorized longevity set. Let's continue to work hand in hand, leveraging our collective strength to build our community.